when you go and you see your patients, what do they want? So we talked about that all the time, our team, and this is a concept that has been working with me since I started doing implant surgery. I was lucky enough to always be around excellent prosthodontists. And early on, as an oral surgeon, I understood that patients do not want implants. All they want is teeth. They allow me to drill the bone. They allow us to try to grow bone, do soft tissue management, everything, every crazy thing that we want to do because they want teeth. They don't want any implants. If you tell the patient, well, you want to choose this implant or that implant, they say, you went to dental school, not me. They want teeth. So they want the right teeth. They want implants to support the restoration with minimal problems, with minimal future complications, easy maintenance, mechanical, biological, good cost benefit. They want to invest less money, less time, and have a long life lasting restoration, which not always we can achieve. So communication and making the patient understand what we can do is really important, because they have to understand our limitations. They have to understand the outcomes. They have to understand and accept and consent and pay for the crazy grafting materials that we want to use, or why we're going to this implant instead of that implant. At the end, all they want is teeth with a good cost-benefit ratio. So we need to know that the treatment plan starts with the final restoration as a goal. We have to have realistic expectations regarding surgery, final result, the risks, and the long-term maintenance, because we don't want to create a biological problem to this patient.